You take off your socks at the end of the day, and the deep red indentations look like they were carved into your skin. Your ankles are thick, heavy, and throbbing. You press a thumb into the top of your foot, and the skin stays pushed in, leaving a deep dimple that takes several seconds to slowly fill back up. You have probably been told that this is just a normal part of getting older, that gravity is finally winning the battle, and that you just need to put your feet up. But treating swollen feet as a harmless, cosmetic annoyance of aging is a massive biological mistake. That swelling, known clinically as peripheral edema, is not just a cosmetic issue. It is a blaring dashboard warning light telling you that the delicate plumbing system inside your lower body is actively failing, and the toxic, inflammatory fluid your body is desperately trying to filter out is getting trapped in your tissues. Tonight, we are going completely under the hood. We are going to decode the exact mechanical failures causing your feet to swell, and I am going to give you the precise, biological bedtime fixes that will physically force that fluid out of your legs while you sleep. To stop the swelling, you first have to understand the massive engineering challenge inside the human cardiovascular system. Your heart is an incredibly powerful, thick-muscled pump. When it beats, it easily blasts oxygen-rich blood down through your arteries, all the way to your toes. That is the easy part. The hard part is getting that blood all the way back up to your chest. Unlike your arteries, your veins do not have a dedicated pump, and they are fighting an exhausting, uphill battle against gravity. To accomplish this, your body relies on a secondary system. Your calf muscles act as the pump, squeezing the veins every time you take a step. Inside those veins are microscopic, delicate trapdoors called valves. The blood gets pushed up by the muscle, and the trapdoor snaps shut so the blood cannot fall back down. But after 60 years of standing, walking, and sitting, those delicate trapdoors begin to wear out. The tissue loses its elasticity. The valves fail to close completely, becoming leaky. This is a condition called chronic venous insufficiency. When the trapdoors leak, blood falls backward and pools in the lower legs. The pressure inside the veins builds up so intensely that the watery part of your blood is physically forced out through the vein walls and into the surrounding tissue. That leaking fluid is the puffy, tight swelling you feel at the end of the day. But the veins are only half of the story. You have a completely separate, invisible plumbing network called the lymphatic system. If your veins are the water pipes, your lymphatic system is the biological sewer line. It is responsible for clearing out cellular waste, dead proteins, and inflammatory debris from your tissues. When your veins leak fluid into your feet, the lymphatic system kicks into overdrive to try and vacuum it up. But the lymphatic system is incredibly fragile. It does not have a central pump at all. It relies entirely on the tiny, microscopic contractions of the vessels and the physical movement of your muscles to push the fluid upward. When your veins are dumping massive amounts of fluid into your ankles, the lymphatic sewer line is rapidly overwhelmed. The fluid gets backed up, it becomes thick, and it begins to harden the tissue in your lower legs. If you do not actively intervene and force this fluid out, the chronic swelling will eventually choke off the oxygen supply to your skin, leading to discoloration, fragile skin, and severe weeping ulcers that refuse to heal. You cannot solve a mechanical plumbing problem with a pill. You have to use physics. The first bedtime fix is true hydrostatic elevation. When most seniors are told to elevate their feet, they sit in a recliner or prop their feet up on a small footstool while watching television. Biomechanically, this does absolutely nothing. For elevation to work, your feet must be physically higher than the right atrium of your heart. You have to create a steep, downward gravitational slope so the fluid has no choice but to drain out of the tissue. Before you go to sleep, you must lie completely flat on your back in bed or on the floor. Place 3 to 4 thick, firm pillows under your calves, raising your feet at least 12 inches above your chest. You must stay in this exact, unbroken position for a minimum of 20 minutes. You are using the raw force of gravity to reverse the hydrostatic pressure in your legs, forcing the pooled fluid out of the tissues, back into the veins, and down into your central circulation where your kidneys can finally filter it out. While your legs are elevated, you must activate the second bedtime fix, which is the ultimate biological hack for your lymphatic system, the diaphragmatic vacuum. Because the lymphatic system does not have a heart to pump it, it relies heavily on the pressure changes inside your chest cavity. The largest lymphatic vessel in your body, the thoracic duct, runs right up through your abdomen and into your chest. When you breathe shallowly into your upper chest, which is how most people breathe when they are stressed or tired, that duct remains stagnant. But when you execute deep, diaphragmatic breathing, you turn your lungs into a massive biological vacuum cleaner. While lying flat with your legs elevated, place your hands on your stomach. Inhale deeply through your nose for a slow count of 5, forcing your stomach to push up against your hands. Your chest should barely move. This deep belly breath pulls your diaphragm muscle downward, creating a massive pocket of negative pressure in your chest cavity. This negative pressure literally acts as a suction cup, vacuuming the thick lymphatic fluid up out of your legs and pulling it into the core of your body. Exhale slowly through your mouth for a count of 7. Perform this deep, vacuum breathing for 5 solid minutes while your legs are elevated. You are manually pumping the sewer line. The third bedtime intervention is manual retrograde massage. Once you sit up on the edge of your bed, you can physically sweep the remaining fluid out of the superficial tissues. But this is not a deep tissue muscle massage. If you dig your thumbs deep into your calves, you will completely miss the lymphatic vessels, which sit just millimeters beneath the surface of the skin. You must use a very light, broad, sweeping touch. Place both hands around your ankle. Using the flat palms of your hands, gently stroke upward along your calf, moving toward the back of your knee. You are not squeezing the muscle. You are lightly stretching the skin upward. The back of your knee is home to a massive cluster of lymph nodes. You are literally sweeping the toxic fluid up the leg and dumping it into the filtration nodes behind the knee. Repeat this gentle, upward sweeping motion 15 times on each leg. Never massage downward toward the foot. You must always sweep upward, moving the fluid strictly toward the heart. But we cannot just talk about mechanics. We have to address the chemical saboteurs that are forcing your body to hoard this fluid in the first place. You can elevate your legs and breathe perfectly, but if you are swallowing the wrong chemical compounds before bed, you will wake up swollen. The most common culprit is your evening painkiller. Millions of seniors take an over-the-counter NSAID, like ibuprofen or naproxen, before bed to manage a stiff knee or an aching back. These medications aggressively force your kidneys to retain sodium. Where sodium goes, water follows. Your kidneys lock up, your blood volume expands, and the excess water is pushed straight out into your ankles. If you take an NSAID at 8 o'clock at night, you are chemically guaranteeing that your feet will swell while you sleep. Furthermore, if you are prescribed a calcium channel blocker for your blood pressure, like amlodipine, you must understand its exact side effect. This drug forcefully dilates your arteries, allowing blood to rush down into your feet easily. But it does not dilate your veins equally. The blood rushes down, but the veins are too narrow to carry it back up. The pressure mismatch forces fluid into your tissues. If your swelling started exactly when your doctor prescribed this medication, you must have a direct conversation with them about the specific pharmaceutical trap you are in. You must also fix the cellular mineral balance before your head hits the pillow. Your body is fighting a constant tug-of-war between sodium, which pulls water into the tissues, and potassium and magnesium, which push water out. The modern diet heavily loads seniors with hidden sodium, especially in the evening. A bowl of canned soup or a slice of deli meat at dinner completely overwhelms your kidney's ability to filter fluid. To counteract this, you must consume a massive, bioavailable dose of magnesium in the evening. Magnesium physically regulates the cellular pumps that push excess fluid out of the cells and back into the bloodstream. A handful of raw pumpkin seeds or a high-quality chelated magnesium glycinate supplement an hour before bed gives your vascular system the exact biological key it needs to unlock the cells and flush the stagnant water out of your legs. There is one absolute, non-negotiable medical warning that must be addressed. Everything we have discussed tonight applies to bilateral swelling, swelling that happens in both feet or both legs simultaneously. Bilateral swelling means you have a systemic issue with your venous return, your lymphatics, or your kidneys. But if you look down and notice that only one leg is swollen, while the other looks perfectly normal, you must stop immediately. If that single swollen leg is red, warm to the touch, or accompanied by a deep, throbbing ache in the calf muscle, do not elevate it. Do not massage it. You must go to the emergency room immediately. Unilateral swelling is the cardinal, screaming red flag for a deep vein thrombosis or a DVT. This is a solid blood clot lodged inside the deep veins of your leg. If you massage a DVT or try to aggressively squeeze it with a tight sock, you can break the clot free. It will travel directly up your venous system and lodge in your lungs, causing a pulmonary embolism, which can be instantly fatal. One swollen leg is a severe medical emergency. Two swollen legs is a systemic mechanical puzzle you need to solve. Your body is governed by the laws of physics and biology. Your swollen feet are not a mysterious curse. They are the result of failing trapdoors, overwhelmed lymphatic sewers, and chemical sodium traps. You have the exact tools to fix this. When you go to bed tonight, use true hydrostatic elevation to let gravity do the heavy lifting. Execute the diaphragmatic vacuum to suction the lymphatic fluid up into your core. Sweep the remaining fluid out with light, upward retrograde massage. And evaluate every single pill you take in the evening to ensure you are not chemically poisoning your own kidneys. This information is based strictly on deep clinical biomechanics and physiological reflexology. It is strictly for educational purposes and is never a replacement for the personalized care of your physician. Stop accepting swollen, heavy legs as a normal part of your life. Take exceptional care of your vascular system. Do the mechanical work your body requires, and I will see you in the next video.